I'd like to invite up is Mr. Edward Wolfman.
Good morning, everybody. Nice to see all of you. Dr. Little, it's really nice to see you again. We met exactly once. You walked into my room at Cedars and said, "You can go home." That was the entire conversation, so you're very high on my list. In preparing my remarks today, I looked to a great elocutioner for inspiration. That person's Vin Scully. In my mind, his excellence personified. Upon his election to the Baseball Hall of Fame, he gave a brief thank you speech that I'm liberally stealing from and modifying on this occasion. A vital portion of human existence is that when we are visited with misfortune, we look to the heavens and we say, "Why me? Why, with the millions and millions of people on this earth, am I asked to bear this burden?" And when I was diagnosed with multiple myeloma, and I first heard the awful C word applied to me, I did look up and ask, "Why me?" Just as I'm sure most of you did. And yet, if I'm to be honest with you and myself today, I have to ask the same question when good fortune comes my way. Why me? Why, with all the thousands of fellow travelers suffering from this awful disease, was I able to respond well to Velcade? To live a relatively normal life? To make it through the transplant relatively quickly and bounce back so completely in such a short time? Why am I given the honor of addressing fellow survivors when any of you could have just as compelling a story to tell as I? Why me indeed? I don't have the answer to that question in either situation, but I can tell you how I feel. I want to sing. I want to dance. I want to shout. I want to cry. And I want to be thankful and humble with great thanksgiving. And I want to tell all of you how much it means to me to be sharing this moment with you. I often tell people that if there is such a thing as a lucky cancer patient, I'm it. My journey through myeloma has been remarkably easy. I've never been in any great pain. The worst it ever got for me was some rib pain that I initially felt was a pulled muscle from playing golf. It was that pain that brought me to an orthopedist who took an x-ray and glumly told me that, quote, "There may be some pathology here." I was put on a regimen of Velcade, and I was given the Stephen King version of all the potential side effects. I experienced almost none of them. I never got nauseous. I only had very minor neuropathy, not even enough to affect my guitar playing. I experienced about 3 days of crushing fatigue during the 3 months of initial treatment. And on those days, I'd leave work and take myself out for a round of golf, with the feeling that putting one foot in front of the other to stay awake was preferable to sleeping all day and staying up all night. And then there was the dexamethasone. Sorry, folks, nothing good I can say about the dexamethasone. Those of you who take it know what I mean. But getting back to the story of the lucky cancer patient, the Velcade-Dex combo was very effective and resulted in nearly 5 years of solid remission. Throughout that time, I never experienced any pain or discomfort owing to the disease. I worked, I played tennis and golf and rode my bike. I got to the point where I would tell people that cancer wasn't even really my biggest problem. When I relapsed, I was put on the transplant track. And I can tell you honestly that I had one of the easiest transplant experiences known to mankind, and of course a lot of that's attributable to the staff here at Cedars. I had no problem with the Velcade cytoxin induction therapy, although I did fret that any drug that had toxin in its name would be a beast. When the time came for my cells to be harvested, I was told that I could take anywhere from 2 to 5 days to collect enough cells, and I knocked it out in 1 day. The transplant took place at Cedars in February of 2012, about 18 months ago. I had very little discomfort in the hospital. My biggest complaint at the time was that they didn't have HBO. I threw up once the whole time. I was released to go home by Dr. Little in 10 days. And within about 6 weeks from when I checked into Cedars for treatment, I was back at work. Today I'm here. I'm in remission. I'm taking Revlimid and prednisone, Yay, prednisone, not DEX. They don't bother me at all, and I'm full of optimism. When I last met with Dr. Vestio, I told him, and this is true, that I was making retirement plans, and I told him I was using the age 90 as my expiration date. And he told me that's what I would do if I were you. So I ask again, why me? And there's no answer. Well, I worry sometimes that my story is so atypical that it may give others false expectations about what their journey will be like. I also hope that sharing my story can give hope to some fellow travelers who may think there's no hope for living through this thing or living through it well. I had an occasion to meet last week with an 86-year-old gentleman who had just received a multiple myeloma diagnosis. He's an amazing guy. He has a very sharp mind. He sharp as a tack. He moves around like a normal guy. He has no problem walking around. Plays golf. Goes to work every day, and he's otherwise very, very healthy. And I spent an afternoon going over what he can expect in his journey. And in the end, he asked me what piece of advice I could give him. My response was, don't worry. That's not to say that we've won the war on this disease. Far from it. But with new treatments coming out at an almost logarithmic pace, I feel great optimism. And I look at my fellow transplant survivors, and I can tell you my heart is full of joy and gratitude and optimism. We're a lucky bunch of cancer patients, and there is such a thing. Thank you.